Vitamin D is a godsend vitamin you can absorb from the sun, but is your body really absorbing it sufficiently? Several things can interfere with your vitamin D absorption you might not be aware of. And as you probably know, if you're deficient in this vitamin, your body can welcome many diseases because vitamin D deficiency directly affects the immune system. That's why many people sit in the sun to supply this vitamin and stare at the sky to absorb the necessary vitamin D in their bodies. But is it enough? Just bathing in the sun may not be enough. You require more to make sure your body is absorbing the vitamin D you're delivering to it. And unfortunately, there are many elements that can block vitamin D absorption in the body. In this video on parshealthhtv, we are going to be sharing with you 7 of these critical factors. Stay tuned with us. Number 7. Poor gut health. Vitamin D that you obtain from food items or supplements is absorbed in one part of your small intestine, which is instantly downstream from your gut. The absorption of this vitamin relies on factors like bile from the liver, the stomach juices released, enzyme secretions from the pancreas, the integrity of the wall of the intestine, and many more. Vitamin D absorption definitely decreases when these elements are impacted due to health disorders like celiac disease, chronic pancreatitis, Crohn's disease, and cystic fibrosis. Number 6. Liver problems. Vitamin D deficiency is relatively common in people with liver diseases. Even if a person suffers from mild liver disease, they will indeed have some degree of vitamin D insufficiency. Individuals with liver cirrhosis can suffer from a severe deficiency of this vitamin that can cause more health issues for them. Number 5. Kidney diseases. The kidneys have a crucial role in ensuring the proper absorption of vitamin D for your body. Suppose a patient suffers from a kidney disorder. In that case, there is a high probability their vitamin D levels will be lower than they should be. Injured kidneys will not be able to change enough vitamin D into its active form, calcitriol, which is utilized throughout the body. Number 4. Increased intake of caffeine. Many people may not be able to function without their morning cups of coffee, but it is necessary to know that an increased intake of caffeine could hinder your body's ability to absorb vitamin D. Drink coffee or other food items that include caffeine in moderation to stop vitamin D deficiency. Number 3. Body mass index over 29. Obese or overweight individuals require more vitamin D. In fact, lack of vitamin D is one of the reasons behind weight gain. In this case, where individuals are obese, their subcutaneous fat traps vitamin D molecules, causing restriction in its absorption. To boost your vitamin D intake, spend time in the sunlight, and take supplements and vitamin D-rich foods. Number 2. Weight loss treatment. Radiation treatment and weight loss surgeries like bariatric surgery put obese people at risk of numerous nutritional deficiencies, such as vitamin D, by limiting vitamin D absorption. Number 1. Some drugs. Drugs like oral steroids and diuretics also restrict vitamin D absorption in your body. If you are deficient in vitamin D at any level, you should avoid the consumption of some specific foods because they can also make vitamin D absorption difficult or impossible in the body. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Now, let's see what else can block vitamin D absorption. Studies have shown that this problem also occurs in polluted cities where sunlight does not have the required quality. Also, people with darker skin need more sunlight to supply vitamin D. The necessary amount of sunlight to provide vitamin D to the body is 20 minutes of direct sunlight daily. Keep in mind that indirect sunlight, such as sunlight from behind glass, loses this property. Vitamin D absorption with sunscreen or without sunscreen is also a question. If you use glasses or sunscreen, the production of vitamin D is at its minimal levels. It sometimes even reaches zero, which has caused doubts about using sunscreen to fight skin cancer or not. Using sunscreen will cause a lack of vitamin D in the body, and not using it will cause other diseases, including accelerating and intensifying the skin aging process, creating sun spots on the skin surface, and causing various skin cancers. To use the beneficial effects of sunlight in making vitamin D and, at the same time, preventing it from occurring, depending on the type and color of the skin, a person can be exposed to sunlight for 20 to 30 minutes without using sunscreen. If this time is repeated several times a week, you can get the required amount of vitamin D. Pregnant and lactating women are also recommended to expose their hands and face to direct sunlight for at least 10 minutes a day. It is necessary to use sunscreen with a protection factor of more than 30 to protect against ultraviolet rays. It should be renewed every 3 to 4 hours. Another point is that when you use sunscreen, you should apply enough on the skin to completely cover the skin. Sunscreen should be used so that it forms a thin layer on the skin and can fully apply its protective effect. Which one of these factors are you dealing with? Feel free to tell us in the comments section below. And don't forget to subscribe. You can also check out our content on the left and right of the screen for more awesome content from us.